So welcome to the Ohio Individual Service Plan or Ohio ISP overview webinar, and this is for intermediate care facilities or ICFs. And so if you're not an ICF staff, you're probably in the wrong place. This webinar is designed for all ICF staff. And before we get started, I'm going to introduce the DODD team that will be assisting today. So first is Heather Stubbs, and she is our Information Technology Supervisor. And give a wave there, Heather. Okay. We also have Abby Shelton, who is part of our Information Technology team. She speaks fluent French as well. I'm sorry, fluent Japanese. Yeah.
I speak a little bit of French.
French too? Okay.
I've forgotten most of it by now, but yeah.
maybe you can do your part in Japanese and we'll see
okay, I could do that. See if anybody gets it.
Yeah. All right. Heidi Davidson. She is our regional coordination manager for we go by superintendent regions with our regional model, and so she is regions 4, 5, and 6. So Heidi covers the eastern half of the state. So you'll be seeing her today. We also have Rachel Roseman, who is a regional support facilitator, and she is in Superintendent Region 1 up there in the northwest part of the state. Rachel. Okay. And I am Jim Bennett, and I am a regional support facilitator as well. I cover Region 6 in the northeast part of the state. So just a couple quick things before we get into the actual webinar. If anyone has questions, we do have a chat. I wish I could show the chat button with my, I tend to use this this laser pointer throughout, so bear with me there. But on the top part of your screen, or Abby, might be in the bottom, depending on if they're using the browser, there's that chat button. Okay.
Yeah, if you're using the web-based version of Teams, then there'll be a menu towards the bottom of the screen where you see us and the screen Jim is sharing. Otherwise, it'll be in the top right corner.
Okay. And I should also mention we have our Ohio ISP, one of our other managers, Beth Chambers, with us, and she is doing one of her favorite jobs, which is admitting people into the meeting. So there she is. Hi, Beth. So if you do have any questions, you can drop those in the chat. We will have a question and answer session at the end, and we only have an hour, so we're going to go ahead and get started. So just quickly, the objectives for this session. We want to enhance understanding of why the Ohio ISP was developed and how it is designed to help those we serve. A lot of you have already taken some of those initial trainings which covered this. We realize that we're kind of covering a broad audience, some folks who may not have been required to take those trainings. We're going to be addressing some other staff who are in ICFs as well today. So this might be, some of the slides might be new to some of you and not new to others. So hopefully you find some of that material beneficial. We will take some steps to show you how to access the DODD online system, and that is relevant to those who are using our system as well as those who are using third-party vendor systems, because Abby will go through that in a little more detail, but you will still need to log into the DODD system no matter which system you're using. We are going to focus that more on the ICF staff, like not the director of operations or QIDPs. It's going to be more focused on how to get those access for like the DSPs, the nurses, social workers, anyone else who may just need to get in to take a look at the plans and maybe do some other things in the system. We do realize there's probably going to be a lot of DOOs. I see some familiar names and faces here. There's going to be some QIDPs, QIDP administrators. We have done some things to help those folks. We had several help sessions throughout August and September to assist. So we know a lot of you may already have access, but if you do not, some of that information today will still be relevant. And we also do have a full onboarding guide, which we'll share that resource later in the presentation. And finally, the last objective for today is to recognize how that service plan will be developed and how it will look using the OhioISP. There's my laser pointer. Okay, we're done. Moving on to the next. Okay, so again, this slide probably looks familiar to a lot of you. For those of you who took the initial OhioISP trainings, you may have seen this. Talks about when we were initially developing the OhioISP, some of the hopes. We had some town hall meetings that were conducted to really understand what people had hoped for out of the OhioISP and some of the fears that they may have had before the whole project got started. When we gathered that feedback, this is sort of the result of it here. It's what we call a word cloud. The larger words represent the more frequent responses. So some of the more common hopes that you see expressed by the field were person-centered, simplicity, consistency, easier for providers, easy to understand, some things like that. And then the next slide here goes over the fears. So these are some of the more common fears: not person-centered, long, frequent changes, IT issues. So you could kind of take a look at some of those things there. As you expect, many of the fears are directly opposite of the hopes. So they want simplicity as opposed to being long, or person-centered as opposed to not being person-centered. But what's also interesting is we found that some of the hopes and fears were the same. So like some folks were hopeful for a standardized plan, while others were fearful about it being too standardized. So we tried to, I know the work group that developed this really tried to strike a balance, and we really tried to listen to you all throughout this process. I know there were a lot of ICF voices that were part of that initial work group and throughout. So certainly want you all to know that your voices have been heard. So we have a video here talking about the development of the OhioISP. It was developed and, as I mentioned, tested by people from all areas of the field. We had people receiving services, family members, county boards, ICFs, waiver providers, some of our partner associations, and DODD staff. So really all-inclusive, and hopefully trying to represent the needs of each area of the field. So I'm going to play this video.
The Ohio Department of Developmental Disabilities, or DODD, has made a commitment to improve the quality of life for Ohioans with developmental disabilities and their families. To do this, DODD has worked with partners to develop a way to keep the people we serve at the center of the planning process, a way to make sure collaboration between all team members is smooth and simple, and a way to make sure planning services and supports is consistent throughout Ohio. The Ohio Individual Service Plan. One assessment and service plan for all Ohioans who receive developmental disability services.
Okay. And shout out to Chris Leva, who is one of our communications people, training, not sure of his official title, but who had developed the logo that we use, which I think really represents what's kind of represented with the OhioISP and some of the philosophy behind it. Okay, so now we are going to move. Can everyone see this okay? Everyone see my screen again? Okay. Now we are going to move to the philosophy. Rachel's going to talk about the philosophy in a little further detail. So Rachel, take it away.
Thanks, Jim. A really important part of the Ohio ISP is knowing that it's person-centered. So the Ohio ISP was built on the Charting the Life course core belief that all people have the right to live, love, work, play, and pursue their life aspirations. The Ohio ISP places the needs of the person receiving services in the center of the planning process. So the person leads that planning process by making choices, they set goals, and they decide how they want to live their life. There are those times where a person is unable to fully lead that planning process or chooses not to lead that planning process, and they can choose to have the assistance of someone else or have the team identify a team member or person that's closest to the person to help support the planning efforts. The Ohio ISP starts with the communication section. This section identifies how the person can communicate their wants and needs. The section also identifies who helps communicate their wants and needs. All other assessment and planning builds from the core focus of how to best communicate with that person and how they best communicate.
Yeah, and Rachel, I just wanted to add, so with ICFs in particular, we get that question a lot, right? And Rachel previously worked in one of our developmental centers and sort of has that experience in working with people who you know, may not have the same level of skills or abilities. So we get that question a lot, like, you know, leading the process might be a little more difficult for those folks. And so I think we could still sort of be aware of that and kind of make sure that they're still taking the lead in some way.
And for folks on the call, and again, I know Jim mentioned there's Qs and DOOs and hopefully some DSP staff. And you folks often know the person better than anyone else. So you do have a lot of really important voice in assisting that person communicate what their hopes and dreams are.
Yeah, and again, for those jumping on, we are recording this, so we will, you'll be able to share with your staff as you see fit.
And as we just were discussing, everyone on the team is essential. Each team member is equally as important to the success, planning, and implementing of a person's Ohio ISP. So a team consists of a person, their family, friends, other professionals, and anyone that person chooses to have be a part of their team. By asking questions and working with the person as their guide, the team explores the person's vision of what a good life is in their current circumstances, as well as what that good life would look like in the future. The team explores all experiences and areas of a person's life and considers every age and upcoming life changes, not just the current situation. The Ohio ISP and assessment can help people with developmental disabilities, their families, all those team members have more meaningful conversations that are focused on the person and the supports that they need to fulfill their vision of what a good life is.
Yeah, and I think this one's really important as well. You know, I think one of the focuses of the work group early on was that they wanted everyone to feel like they were a part of the team. I think in the past that, you know, hasn't always been the case. Now, ICFs, I think a little different environment than maybe some of the waiver county board situations, but certainly we want to make sure that those people that know the person the best are being heard and that their input is taken into consideration.
And as a previous plan writer, as Jim mentioned, I was a QIDP and I knew the folks I supported. I did. I see them every day. However, I'm not with them a straight 8, sometimes 16 hours a day. Those DSPs, the nurses, you guys really have a lot of that important, valuable information that needs to be contributed and incorporated within that person's Ohio ISP. So another really important piece of the Ohio ISP was having one plan for all of Ohio. So this format is the same no matter where you are in Ohio. People moving throughout the state will have the same plan format and experience the same planning process no matter what county they live in or what provider or providers they choose. And it does all this while maintaining the individuality of the plan content for each person. There's an online platform that is available to teams throughout Ohio to access assessments and plans for the people they support. One of my favorite things about the Ohio ISP is when a person moves. So people move all the time. They move from county to county or a waiver home to a facility or into a developmental center and back out into the community. The Ohio ISP moves with them. So service and support administrators, SSAs, and qualified intellectual disability professionals, QIDPs, can continue using the person's established plan, and the new team will not have to start all over from scratch. This piece is huge, especially for you folks in the ICFs. There definitely is lots of movement in and out of the centers. So to be able to have a plan to already start with and build off of is a huge relief. Another thing that probably lots of our folks in the ICF are concerned about is ODH. How does Medicaid and licensure feel about this? Will this plan cover everything that I need it to cover, or do I still need to do all these additional assessments? So the Ohio Department of Health, ODH, issued the above statement supporting the Ohio ISP implementation. There are meetings with ODH certification management on a routine basis. And DODD is partnering with ODH to improve consistency between state licensing standards and federal Medicaid regulations. If a potential inconsistency is identified, you can share that information with the DODD central office. And now that we have gone over and have a better understanding of the basis for the Ohio ISP, I'm going to hand it over to Abby, and she's going to review how people can begin to access the online system.
Hi, thank you, Rachel. One thing about our system is no matter which vendor you want to go through, if you wanted to go to Ohio ISP directly, if you want to use a third-party vendor like Britco or PSI, you still need to log into our system at least once. This is because our system is the system of truth. And so any other vendors that want access to that, you have to exist in our system first for them to connect you to our system. So to do that, we have a couple of guides on the screen right now. The guides are also available on the Ohio ISP webpage. The first thing though you need to kind of ask yourself is if you have a DODD login, do you have an OHID? If you do, you can go to dodd.ohio.gov and you can log in there. And then you should be able to access it from there in your apps. If you don't know, which I get that a lot, try logging into My Learning. If you can log into My Learning, that's the login that you're going to use. So you do have an OHID. If you try to log in, you think you might have one, but it's not working, you're not sure, you can always contact us at the ITS call center. You can either use your phone. The number is 1-800-617-6733, and you're going to pick option 4. Or you can email us at itscallcenter@dodd.ohio.gov, dodd.ohio.gov, excuse me. And they could kind of help you figure out if you have an account. If you don't have an account, you're going to need to make one. And it's not too involved a process, but we do have a user guide that shows you how to do that. That's the account creation and login guide. Again, a lot of this is available on the Ohio ISP webpage. For those of you who you've created an OHID, you've logged in, you've gone to My Applications, and you don't see the Ohio ISP tile. It's like a little box to click on. If you aren't seeing that, that probably means that you have roles that haven't been added to your account that need to be added. So on the next slide, we've got some sort of a matrix of how to figure out what roles you need. So if you are a DOO or a delegator, the DOO in particular, you should already have your roles assigned to you. That should have come in from PSM. If you log in and don't have that tile, you need to double check that your role is updated in PSM. For you, you're going to have the ability to make changes within OhioISP. For agency delegators, likely it will come over from PSM, your delegator status. However, if you're going to be managing caseloads, you're going to want to also add the QIDP admin role. So for any of these roles, when you're logged into dodd.ohio.gov, in the top right corner, there's a support center link. Click that, and then click that you want to add a role, and then choose for this person, QIDP admin role.
Hey, Abby.
So, yes.
For a delegator, basically it's someone that's acting on behalf of the DOO. So sometimes the DOO may not be involved in this process. They can delegate it to someone else who would be managing that work, correct?
Absolutely, yes, thank you. Yeah. So yeah, a lot of DOs I know don't want to get their hands dirty with that stuff. So yeah, absolutely. Delegator is someone who would do that role for them. So just like with the DOO, they'd be able to assign staff to the agency, make changes within OhioISP. The next one is the QIDP admin. A question I get a lot is, what is an admin? Am I an admin? A QIDP admin is the person who manages the caseloads for the QIDPs. You're the one assigning individuals and stuff like that. So, or adding individuals or adding, queues to your facility. So for those people, if you do that role, regardless of what your actual job title is, you're going to need the QIDP admin role. And so you'll go into Support Center and add the role there. So you can see what you can do in OhioISP is assign case managers to individuals, basically, plus everything a queue can do. For queues, the role that you need is the QIDP role, not the QIDP admin, but the QIDP role. And you'll be able to author plans. Now, one thing about that is until an individual or you have been assigned to an individual, until that happens, you can't edit the plans. So if you look up an individual, you can see them in the system, but can't edit their plans, they're probably not on your caseload yet. So don't panic. It's an easy fix. For other people, such as QIDP assistants or other assistants, if you are going to be modifying plans, you also need that QIDP role. Again, the roles we're talking about aren't necessarily tied to your job title, but to your job function. And then lastly, DSPs, nurses, staff, social workers, people like that, you need the read-only access. You're not going to be editing plans. You're not going to be changing things in OhioISP. You're just going to be reading the plans. So in that case, you need the DODD Salesforce Community Read-Only, it's a mouthful, I know, role. That's the one that you're going to want. So, and as always, if you have questions, you can always reach out to us and we can try to help you figure out who you are and what you do.
Thanks, Abby. The one thing I wanted to call out here was just that there's only, at this time, there's only the ability to assign one case manager. It's a pretty easy click of a button for the admin to switch the case manager from one to another, or the queue from one to another. But at this time, you can only assign one queue as the case manager for that particular individual.
Right, that's correct. So if you know you've previously been assigned an individual but can't edit the plan, it's possible your admin has maybe while you were away or needed some help, they've assigned it to someone else, so just ask them to assign it back. And like Jim said, it's literally there's one button you click who the manager is, and then you're done. It's very quick.
The most important thing is you have the proper roles, and we certainly are able to assist you with getting that. This matrix is part of our full onboarding resource that we mentioned earlier.
And so this is a video that kind of shows the process for individuals and guardians to get into the system. So previously I talked about how like DOOs, delegators, Q admins and Qs get into the system. Even though this one is targeted towards individuals and guardians, and clearly you are not individuals and guardians, the process itself is going to be very, very similar. It's essentially going to be the same. So this is for DSPs, nurses, social workers, other staff. This is the process that you're going to use.
Abby, just
If you
let me
have
know. Can you hear
access
us?
to the Ohio
Yep.
ISP
Abby.
system,
Okay, good.
you'll be able to log in and review your current and past plans. And if your case manager is using the Ohio ISP system, you can also sign plans digitally from your computer or smartphone and chat with the team online. So now you're probably wondering, how can I get access? Ask your case manager, that is the SSA QIDP, to send you an invitation, and once invited, you'll receive an email. The email will provide you with a temporary PIN. Make note of that, and then click the link. Enter the temporary PIN, create a new password, and click Continue. Success! Your password has been created. Now it's time to check your email again. You'll receive an email letting you know your account is ready. It will also give you your new login name. Added link and login. Enter your login name and password, then click Sign In. On the DODD Applications page, click the Applications link at the top of your screen. Click the Ohio ISP tile, select the button that says I'm a provider, individual, family member, guardian delegator, or QIDP, and finally, click ODX. Congratulations, you now have access to all your plans in the Ohio ISP system.
So while Jim's loading that up, so yeah, that kind of covers basically what the login process is. So like I said, it's not terribly complicated. And for those of you using a third-party vendor, you only have to do that once. For those of you who want to use our system directly, this is the login that you'll use. God, I had another thought. What was it? Oh yeah, if you use a third-party vendor and at any time you want to use our system, you always have access. So that's one thing to remember. Don't make a password and forget it. Try to keep hold of it if you can. Thanks.
Thanks, Abby. I should have just left YouTube up because we're actually gonna share a couple more videos here. And shout out to Doug Ritchie who put I'm not sure if he did all of these videos, but he did the last one and does a great job with walking us through some of those steps. We kid him, he sounds like Bob Ross. And so if you're having a bad day and you're struggling, just kind of puts you at ease. So go and listen to one of his videos. All right, so this one is the provider walkthrough video. We're gonna share kind of a series of videos. I think these are I think Pete did these ones, Abby, right? If I remember correctly.
I believe so, yeah.
Okay. All right, so shout out to Pete Stroup who did these videos. These were developed for waiver providers. So again, not necessarily the target audience we have here, but these videos do apply to those in the audience who will have read-only access in the Ohio ISP system. So if you're a QIDP or administrator with the ability to edit, there's a series of videos for you all on our Ohio ISP website and on our YouTube channel to walk you through navigation in the system. This is really for those who might have a little more limited access in what they would be able to see. It's just for the non-edit only crowd. So this first video I'm going to show you is a walkthrough of the DODD online system. So I'm going to go ahead, and I'm sorry for all the back and forth. Go ahead and pull this up in the YouTube channel. Heidi, any questions we can address in the chat while we're waiting?
No, there was one that I answered in the chat. It was
Okay.
kind of specific for that person.
Great. All right, so this is the, again, this is called the provider walkthrough, but it will be relevant for those of you who have read-only access. I don't feel like I toggled the sound, so let me do that before I pull this up.
Welcome to OhioISP. This video will include the provider dashboard, walkthrough and user experience, as well as the WalkMe help. After logging in, you'll see the provider's dashboard. The navigation bar at the top takes you to the sections of OhioISP you will use the most. The tiles on the front page are specific to your user experience. Click the home icon at any time to return to the dashboard. The Details tab displays the individual's demographic information, case management status, and other useful fields. The Team tab includes information about the individual's support system, team members, their roles, and any facilities the individual is a part of. The Plans tab includes the most recently viewed plans as well as all prior plans drafted for the individual. My Documents includes files owned and uploaded by you and documents shared with you by a team member. The Help tab includes links to Help Desk, the DODD main page, and rules in effect. The Global Search bar will help you find specific records. It searches across record types to help you find what you need, whether it's user, contact, or account. If you need help in OhioISP, click the Need Help launcher at the bottom corner. The Help section includes documents for setting up OHID accounts, creating a Gmail account, submitting help tickets, and more from the General Knowledge tab. Walkthroughs can be found on the Help tab. Click a walkthrough to follow a process step by step. Click on the X on any open walkthrough to exit the Smart Walkthrough. You can search for materials using the search bar. The Videos tab includes demos and useful walkthrough videos.
All right, so again, thank you to Pete for developing that. And then the next two videos, I think, are also videos that Pete developed. I think the one of the really nice things about the DODD system is that we do have that we call it a walkthrough or a WalkMe in that help section in the bottom right hand corner of the system that really does allow you to go and within the system be able to find certain things, certain videos or resources that'll help you get through and navigate the system. So instead of switching back and forth, I'll save you the headache of that. We're just going to jump right into the next video, which is about reviewing an ISP, which again, a lot of the other staff within an ICF might be doing. A direct care staff could have access, nursing, psychology, social worker, etc.
Welcome to OhioISP. Cover how to review an ISP in the OhioISP system as a provider. OhioISP includes information on upcoming and draft ISPs in the Plans tab. The Plans tab will include all draft and submitted ISPs for the individual, including the ISP name, their status, and created date. Click on the ISP name to review the plan. Once a plan has been submitted for signatures, all applicable team members will receive an email notification to review and sign the plan. Clicking on the first link in the email will open your plan in OhioISP. The Files section contains a PDF version of the ISP that can be printed for use or signed and uploaded to provide an in-person signature. You can review the sections of your plan by clicking the tabs along the top. A provider will typically have read-only access in OhioISP. Clicking the hyperlinks in each section will provide more information on assessment answers, services and supports, and potential outcomes for the ISP. Anywhere you see the plan name, you can click to get back to the plan. The notification email will also include a link to review recent changes that have been made to the ISP. This will include where the change to the ISP was made, who made the change, and when the change was made.
Okay, and the last video as part of the series talks about signatures. So signatures, we have a lot of questions from ICFs about, well, the nursing director always is part of the team and needs to sign the plan. How would they go about doing that? So getting them to be a part of the team is the initial step. And then once you add the relationship and add them to the team, they can go ahead and be assigned as a signatory, which allows them to sign the plan. They do not have to do it electronically. This process can be done as you always have, as written signature. So you can print and sign it as a written signature, and then that could be uploaded into the system and then documented as such. So we'll go through, if desired, the process of signing a plan digitally.
Welcome to OhioISP. This video will include how to sign an ISP digitally as a provider. A provider will be emailed a notification to review and sign the plan. Let's start by logging into OhioISP. Log in using your OHID. If you don't have an OHID, you can create one by clicking Create Account. If you forgot your OHID, click Forgot OHID to be sent a reminder. If you need to reset your password, click Forgot Password. To sign a plan digitally, you will receive an email notification asking you to review and sign the plan. The email notification will include 3 links. The first link is to review the plan in OhioISP. The second link is to sign and approve the plan. The third link will only show the changes to the plan since last signature. Once you've logged in, the team signature page will show. By checking the boxes below, you agree that the plan reflects actions, services, and supports as requested by the person listed. Complete the check marks under participation and informed consent. For the last 3 questions, answer yes, no, or not applicable. Once you have the green check mark, you're clear to sign the plan. If you do not agree with sections of the plan, enter your reason for disagreement in the box below. If you click Submit, after entering a reason for disagreement, a dissenting opinion will be added to the ISP. But we'll go ahead and sign the plan. Check the box above to digitally sign the plan. Today's date will pre-populate, and click Submit to complete the process.
Okay, hopefully you found those videos beneficial. I think the biggest thing for ICFs would be, again, you may have your own system as far as signatures and such, but I would imagine most people would be on the same page as far as consenting to the plan. Again, for anyone who has questions, you can feel free to drop in the chat. We will also have a Q&A here in a little bit. Just a few more things before we get to that point, though. So in addition to the tools that are available for QIDPs to enter an OhioISP into the online system, the DODD platform does provide some additional features for ICF staff that are part of the team. So team members can upload files into the system. Staff can access and print the documentation sheets, which are pre-populated with the services and supports that are included in the OhioISP. So these documentation sheets are designed to meet all of the compliance requirements as long as they're filled out appropriately. You do not have to use these sheets. So just a note that you can continue to use your current service documentation sheets and system if desired. And then just sort of a side note as well, the documentation sheets for outcomes they do not currently populate in the online system. We do have an outcome template that is available on our website as a resource. So you can use that and enter the outcomes, or again, you can kind of use your existing system to document on outcomes. And then finally, a feature that's specific to the DODD online system is called Chatter. Chatter's a tool similar to social media, such as Facebook or Twitter, that allows team members to communicate with each other within the online system. So it really kind of gets back to the need to communicate as a team and ensure that we are getting information from one team member to the next. There is a video on Chatter. I think in the interest of time, just because it's such a short video, I think we're going to skip over this one. This is available on our DODD on our YouTube channel, so you can go ahead and access that if you wish. The part that would apply to everyone is about 2 minutes in, because the Chatter features specific to each. It's sort of built into the ISP process. There's not like a general Chatter feature anymore. So you'd want to, if you go to that video, really the relevant portion begins about 2 minutes in. Some of you may have seen this cycle before that we've used, and this is really sort of the core functions of an SSA or QIDP. So these 4 core responsibilities really focused on helping the person serve to live a good, meaningful life. Starts with assessment, and we want you all to be curious, get to know the person, connect with them and those closest to them. And all team members should have an opportunity to provide input. So really the people that know the person best. So the person drives it, but we want to ensure that everyone has an opportunity to give their input. We also want to remember that everyone communicates in their own way, and that this is really a discovery phase. It's not where we're identifying services. So, I think it's a little different between county boards and ICFs, but you really want to focus on what that person needs and wants in this area. So those questions are really designed to get at that information. And also to remember that the assessment doesn't need to be completed in one session, and it shouldn't really be part of a formal meeting. I think a lot of times we like to ask people what they want and need when we're sitting around a table in front of a lot of other people. And we really want that to be more of an informal process, more of a casual process. Get the person in an environment where they feel comfortable and are comfortable answering those questions. Kind of move into the planning phase where the assessment drives the planning process and how we're going to use that information to meet the needs of the person. Want to make sure we're using person-centered language and ensure that the services are provided in the least restrictive setting using the least restrictive services. We also, QIDP should ensure that the staff understand exactly what services and supports they are expected to provide. So the last thing we want to do is to write a plan that the DSPs can't understand and implement. So make sure that it's written in simple language and in a person-centered way. Then we have sort of some of the steps that sometimes get forgotten. I think in ICFs it's a little easier to follow the monitoring process, but this could be challenging as well. It's super important to make sure that we understand that after the plan is written, that it doesn't just stop there. So we want to make sure we check in with the team. Again, ICFs are at an advantage with that, and have honest conversations about what's working, what's not working, what could be better, and finding creative ways to communicate and share information. And then as inevitably there's going to be revisions. People are going to change their minds, or there's going to be things that aren't working, and we need to continue to revise the plan as needed and update that as the person's life changes, not just once a year, not just as an annual event. So using that feedback and team input to revise the plan and go back to the assessment phase when those changes occur. So then just very briefly about how the OhioISP will look. It's a single plan, so all one, but there's the three sections. You have the assessment, which is sort of the broader scope, a lot of really detail-oriented questions about a person's wants and needs. That filters into the ISP section. And then we have the introduction, or what's really kind of amounts to like a one-page summary. Those are really the most important things that a person that someone needs to know about a person. If it was someone's first day working with that person, what would they need to know to help support that person in the best way? We're going to share a video here quickly. A team from DODD had gone to work with Lake County and work with them on person-centered planning and the OhioISP, and this video kind of speaks to their experience. So go ahead and share this. Make sure the sound's on before we go ahead and play this.
The Ohio ISP places the needs of the person receiving services in an ICF at the center of the planning process. Over the past year, DODD has provided ongoing assistance regarding the Ohio ISP and person-centered planning to ICFs in Lake County. Recently, an on-site training workshop was conducted.
and working in ICFs for 23 years, I believe that we can often, us Qs, can often get stuck on things have to be in certain language, things have to be in a certain order when we're writing an IP, and we can get stuck. And this has opened up our eyes on how we could say the same thing. And I really like the fact that we could say everything, weave it in this whole process, and it doesn't have to sound like we're talking about a person's inabilities, but it starts to really put a good focus on what they can do. And how we say things, it makes you even realize out in your own personal life, how are you saying things? What words are you using? Because really, we're looking at just simply the quality of that person's life. What really does motivate them, and how can we help them get to where they need to be? But it is challenging, and it wasn't easy. As I listened to all of the cues here talking about, oh my gosh, it took so long. We're handwriting these before our IT system is up. And just that whole process of how long is this taking, and just changing how we see things and changing how we view things. And it's just, it's a change within your own self, not just within the whole system. But I think we definitely are going to be in a better place. Everybody in Ohio that is in an ICF or receiving any services through the Ohio Department of DD are going to be in a better place. We're all going to be communicating the same thing and understanding the same thing about the next person that we have the privilege of helping and assisting.
It definitely is different, and I think it's a good thing that we're not just looking at the same previous plan we've used and adding a couple of things and seeing like small changes, because some of these plans have existed for quite a long time, and then when you really start fresh, you realize maybe these things are no longer applicable to that person. I'm newer to the agency, so I feel like this was also helpful for me to actually get to know on a very personal level all the individuals that I'm writing these plans for. So it's definitely different, but I think it's a good thing.
The training was very helpful because it is intimidating. You think about the pages, you think about the amount of information, you think about trying to capture the picture, and you wanted other people to be able to know that person just as well as you do. So it was kind of intimidating trying to make sure you capture that, but going through the training, you definitely understand now. You're able to look at things from a different perspective and simplify the language, because we're used to saying ambulatory, we're used to saying verbal, but you have to always understand too, people might not understand what ambulatory means or understand verbal. A lot of people use hand gestures. That could be something different from you than how I interpret. So I think definitely just hearing things and looking at it from a fresh eyes, looking at it from a different perspective was definitely helpful.
So throughout this whole process, I have learned a lot from me coming from being a direct support professional for 7 years, being in management for 10 years. I have seen so many changes throughout the years of how we do things as far as writing, how the institutional way of the words that we use versus now making more simplified. So I can say overall, this has been a challenge, but also one of those blessings that I'm able to see the process over the years, how it's changed for the better.
For more information, visit dodd.ohio.gov/OhioISP.
All right. Thank you to Diane McCluskey up at Lake County and her team for sharing their experience with the Ohio ISP and how that kind of changed. I think they referenced the length a little bit, and I think that's a big concern for people, like how much time you need to invest in this because it's something new and you're asking new questions. And we always just kind of tell people there's a big lift up front. There's a lot of new information that kind of goes into it, and maybe some adjustment and becoming familiar with a new process. But I think ultimately it will end up being beneficial and being a something that will save people time and make people's lives better. So just keeping that in mind. So I realize we are up against the clock. I know some people may have to leave and jump to other things, but we will continue to stick around for a little bit to share some resources and answer some other questions. So Rachel, do you want to go ahead and share some information here?
Yeah, so if you aren't familiar with our website, I am going to put a link to it in the chat here. Check it out, familiarize yourself with it. There is a ton of great information and resources on the website. There's frequently asked questions, and those are divided up between groups. So there is a tab for ICFs to make it a little easier to navigate. There's sample plans. There are onboarding resources. We also have a YouTube channel, which is posted here. And that YouTube channel will have all of those videos that were reviewed today if it's something you need to go back and look at a later time.
Thanks, Rachel.
Yeah. And now my favorite part of webinars is let's hear from you guys. Do you have questions and answers? How can we help you? I'm not sure if there's some additional ones in the chat or if Heidi has gotten those. Share the YouTube link. Yes.
I could go ahead and drop that in the chat.
Okay.
Yeah,
And you guys.
Oh, sorry, Rachel. There were only a couple
No.
questions in the chat, and I responded to both of them. One person may be sending an email to the Ohio ISP box.
Perfect. Thank you, Heidi. So you guys can ask questions however you feel comfortable. You can unmute yourself and ask. You can raise your hand. You can type it in the chat. We're here to support you.
And again, there may be people who need to leave, but we are recording this. So if you do need to jump off, someone else might ask a question that is something you were thinking of. Feel free to check out the recording and see if there's anything that you might have missed. Heather just added that there is on the YouTube channel, there's an Ohio ISP playlist with a lot of very informative videos, and they're kind of broken up by sections. So there's some that are gathering videos. There's some that are navigating the IT system. So you should be able to find what you're looking for within those specific categories. Rachel, I think we have a question from Anna.
We have, do you have to search and download plans you have been added as a team member to? So the team, if you are part of a team member, those plans, and if you are a team member for a person, those plans will show in the dashboard of your online system. So you should be able to access those pretty easily. As shown in some of the videos, it would have the person's name, and next to their name would be a number, and the number itself is the ISP.
Yeah, Anna. So anytime you get added as a team member, you'll get an invitation to the team, and you'll be able to see that. Like Rachel said, you'll be able to see that on the dashboard. Abby, Heather, anything else to add to that response?
I would say it depends on the role. So if you are a QIDP or QIDP admin, you should definitely see that. If you are a DSP or a nurse and you have the read-only status, that might be a little bit different. Your dashboard will look a little different. You'll just have the tiles to click on, but you should be able to click on plans and see plans there. You can also search for the individual's name at the top of the screen, and it will pull up that ISP for you. If that still isn't happening And if you're not seeing anything on your main screen when you log in, you might have the wrong roles. So you might need to actually go back and have roles added when you first log into dodd.ohio.gov.
Yeah, and if that's not happening for you, it might be best to reach out to our Ohio ISP email. We'll share that on the next screen, but that's a good way to, we'll be able to help work through whatever issues you might be having. So I apologize for that.
Thanks for jumping in with some more detail, Abby.
Yeah,
I did switch over to the contact us screen so you could see the emails that are listed here. But again, we could still continue with questions and answers.
And as Jim mentioned, all of those email addresses are listed there for all of us on the meeting today. The Ohio ISP email is something that is monitored regularly. So we will respond to any questions you have there within a day or two. Anything else? Feel free to unmute, raise your hands, continue typing in the chat. And if there's things that you think about after we're done here, you can absolutely feel free to reach out to any of us or that Ohio ISP email. All right. Again, feel free to reach out if you think of anything else. We greatly appreciate everyone taking the time to jump in and join us today. We hope you learned some valuable information. And as mentioned throughout this session, this was recorded and we will have it put up on our website as well in case you need to refer back at a later time.
Yeah, thank you everyone for your time and for all that you do for the individuals you serve. Thank you to our team here for their participation. Abby, do you want to send us off? Do you want to say goodbye in Japanese?
So usually at the end of something like this, they'd say, "Otsukaresama deshita," which means basically you must have become in the way of being honorifically exhausted. It doesn't translate very well.
That sounds appropriate.
Yeah.
I'm sure that we have a lot of exhausted folks here.
I think so, yeah.
All right. Well, thank you again to everyone and enjoy the rest of your day.